Good day, my name is Rina and I will be performing the proper way of a nursery care in a hospital setting. So define neonate. Neonate is a newborn child or a infant under 28 days of life or 28 days of age. So there are three principles of an infant newborn care. The first one is establish and maintain a patient airway. The second one is maintain appropriate body temperature, and the third one is immediate assessment of a newborn. So before performing the procedure, make sure that the room temperature is 20 degrees Celsius and have a good ventilation of lighting and have a good ventilation of air. Now prepare all the necessary equipment and supplies. The purpose of this is to facilitate smooth carrying throughout the procedure. So I have here, assuming that this is my basin with the warm water, 2 kidney basin. The one is for disposing for the solid materials. I have here the isopropyl 70% solution alcohol, the calibrated feeding bottle, the tape measure for the anthropometric measurement. I have here the caries prophylaxis, the nose suction, nose suction, the sterile gloves, the cotton buds, the rectal thermometer, and also we have here the weighing scale and the towels, the dresses including the towel. Assumingly I have the dresses of the baby, the double-breasted one, pajama, bonnet, mittens, and boot socks. So now weigh the dresses of the baby and then get the result. After all that, after all the procedure you did, just subtract the baby's weight of the baby's clothes or dressing. Now, assumingly I've already done hand washing, I'm going not to wear the sterile gloves, but before wearing it, check the packaging and check the expiration date to prevent the spread of microorganisms. Make sure to do the proper hand gloving. And now I have here the warm water in the basin with the 27 to 33 degrees Celsius. If you don't have the temperature to test it, then you can use your wrist and elbow to test the temperature of the water. The wrist and the elbow is the most sensitive part of the body to heat. Make sure also that the gloves you are going to wear is accurate size. Do not make it hard to wear it. Now I'm done. So now I'm going to identify the baby through looking the ID tag and the wrist of the baby. And now, after that, after identifying, then now I am going to start cleaning the eye of the baby using the cotton balls. If you know, this is my cotton balls. So, and then right upper canthus, dispose. Lower right canthus, dispose. Small C, dispose. Big C, dispose. And then the S motion from the forehead down to the under the nose, down to the chin, dispose, and do it on the other side. Left upper canthus, dispose. Lower left canthus, dispose. Small C, dispose. Big C, dispose. And then the S motion from the forehead down to the chin, dispose. And after that, clean at the ears and the nose of the baby by using the cotton buds. It is advisable to use the cotton buds once. So here the cotton buds. One stroke only from the nose one. I do it another. So use the other side of the cotton buds and then dispose. And then the ears of the baby. And then use the other side one. And then dispose it. After cleaning, the face of the baby. Now I'm going to wash the head of the baby to remove the vertex, extra mucus, and blood. Put the baby into a football position. By washing, use the towel from the forehead down to the occipital area, gently. And then pat dry the head of the baby, gently pat dry. And then put back into initial position. After that, cover the head of the baby to avoid hypothermia. Now I'm going to clean the lower and upper extremities of the baby. So start from the neck using the towel. Neck. To the pectorals. Down to abdomen. And then from the axilla down to the digital. From axilla down to the digital. And then cover the upper extremities of the baby to avoid hypothermia, and also the head. And I'm going to clean the leg of the baby down to the digital. Avoid touching the inguinal part to avoid the spread of microorganisms. Down to the digital, and then the right one. From the legs down to the digital, and then pat dry. And then gently put the baby into a lateral position to clean the back of the baby and to clean the back legs of the baby. And then pat dry. After that, now I'm going to clean the genital part of the baby. Assuming this is a female baby. Now, I'm going to use the cotton balls by cleaning the genital part. So, from the right labia majora down to the anus, dispose. Left labia majora, dispose. And then the tract, right labia minora, dispose. Left labia minora, dispose. Vaginal opening, dispose down to the anus, and then lastly the anus, dispose. Now cover the body of the baby to avoid hypothermia. And after that, take the anthropometric measurements by using the tape measure. So first, the length from head to toe. Use from head to toe, and then the head circumference, the chest circumference, into the abdominal circumference. After taking the anthropometric measurement, now clean and disinfect the umbilical cord of the baby using the 70% isopropyl alcohol. Cover the lower and upper extremities to avoid hypothermia again. By cleaning the umbilical cord of the baby, I'm going to use a cotton balls and a 70% isopropyl alcohol. Rationale: do not apply the alcohol on the skin surround the umbilical cord of the baby. Apply the alcohol only the stump of the umbilical cord. One circular motion, and then one stroke, and then dispose. After cleaning the umbilical cord of the baby, now I'm going to take the rectal thermometer. Now I have here the rectal thermometer. First is disinfected using the isopropyl alcohol 70% solution. From the bulb to stem, one stroke only by circular motion, and dispose. And and then gently put the baby into a comfortable position and insert the rectal thermometer. Assuming that I already get the result, now remove it and then read it first before disinfecting, because the alcohol has a cooling effect that may alter the result. Now from stem to the bulb, now dispose. After that, after getting the temperature of the baby, now proceed to dressing the baby. Assuming that I have here the dresses, now I'm going to put the disposable diaper, and then the double-breasted dress, the pajama, the the boot socks, the mittens, and lastly the bonnet. But before proceed to dressing the baby, put the soiled blanket into a laundry bin and replace it with another one blanket, with a clean blanket. After the dressing the baby, weigh the baby, and then get the result, and then subtract the weight of the baby's clothes that you were been weighed earlier, and then you are now to get the accurate weight of the baby. Get the baby and then put it back, and then after that, after weighing the baby, now perform to check the swallowing reflection of the baby. Perform a test feeding by putting an ounce of sterile water in a calibrated feeding bottle. Let it be. And then after that, do the physical